speakers and the President, Dr. M.M. Faisal, Secretary, Dr. Anuradha, for joining this session. We have eminent speakers like Dr. Sarita, Dr. Ajit Kumar, who are the stalwarts in this field. We are very lucky, the students are very lucky to have them here. And now I request a warm welcome to all the PG students and the faculty who joined this session. And for the presidential address, I call upon Dr. M.M. Faisal, who is the president of IADVL, Kerala. Over to you, sir.
Hi, good evening to all of you. It is my pleasure to inaugurate this online series of research methodology workshop organized by Executive Committee and the Research Facilitation Cell of IADVL Kerala. Research is an integral part of development in any field. IADVL Kerala is proud to present this series of research methodology workshop. I'm sure this will be beneficial to our members, especially for those who hold keen interest in research. Also, this shall be a guiding light to our young brigades and PG residents in their way forward. I'm grateful for the support and hard work of Chairperson Dr. Sabina Jayapalan, Dr. Convener Mary Vinita, all the members of Research Facilitation Cell and the Executive Committee in designing and executing this initiative. I extend my heartfelt gratitude to the faculty of today's session, Dr. Sarita and Dr. Ajit Kumar. I wish all the best to this workshop series. Thank you.
Thank you, Dr. Faisal, sir, for that warm presidential address. Now we move on to the scientific session. We have very eminent and experts with us who will guide you in the minute aspects of research methodology. It's none other than the past and the present present editor of our prestigious journal, FJS STD, an official journal of Kerala State IADVL. We are lucky to have you both with us. Choosing a thesis topic is not an easy task, and reviewing the literature is yet another Herculean task. To make it simpler, we have with us a highly intellectual, hardworking, my colleague and friend, Dr. Sarita, who did her MBBS and MD from Government Medical College, Kozhikode, and is currently the professor at the Department of Dermatology, Government Medical College, Kozhikode. She has innumerable publications to her credit, and she has authored many books, authored chapters in many books. Over to you, Sarita.
Thank you, ma'am. May I start sharing, ma'am?
Yeah, sure.
Respected seniors and dear friends, good evening to all of you. First of all, I would like to thank Sabina ma'am, Rahima ma'am, Dr. Mary, and the research cell of IADVL Kerala for this opportunity. Indeed, it's an honor to be here. Well, the topic assigned to me is choosing a thesis topic and literature review. Well, why does one need to do a thesis? Why has it been made mandatory in PG training? Advancement of science is based on what is known and what is unknown. It's a continuous quest for finding answers to unknown entities, and medicine being an imperfect science with many normal variations, it is difficult to differentiate abnormal from the normal. So a larger data would give more knowledge regarding the variations that can be anticipated. PG thesis is a way to sensitize the future specialists how to do research properly. then why it's so difficult to choose a thesis topic? It has been like that for all of us. All of us has managed to do it. So the freshers also would be able to do it. Only thing it has become so difficult because dermatology is a much neglected specialty in UG curriculum. There's no separate examination, so that undergraduates tend to ignore it, and only 4 to 6 weeks posting in the 4.5 years course. So when the first year resident comes to the department, he or she doesn't have knowledge even regarding common entities. This has been the story ever since the beginning. We have all gone through it, and thesis topic needs selection within 6 months of initiation of PG training. So the important aspects to be considered while choosing a topic, you have to keep in mind that this is going to be your effort of next 12 to 18 months. Make sure it's worthy of getting published. Especially it is more important because NMC has made it mandatory that all the residents before appearing for their final exam, they should have an article sent to publication in a journal. Thanks to Ajit Sir, who has approved residents of Kerala state to submit their thesis for publication before appearing for examination. Residents in other states are not so fortunate, so you should grab this opportunity and go for a topic that is worthy of getting published. At the same time, it has to be kept in mind that it is only one of the 4 main aspects of your training. A resident is expected to have in-depth knowledge in dermatology, venereology, leprosy, and dermatosurgery at the end of 3 years. He or she should acquire clinical skills by examining and managing patients, should develop communication skills by interacting with patients and caretakers, and develop research skills. One has to make sure that development of research skills does not eat up most of one's time. So opt for a topic that is feasible in your setting. The topic should be feasible. That means you should get adequate number of cases in 12 months time. It is better to go for a 12-month period, though most often we write it as 12 to 18 months. The next 6 months one can utilize for properly writing up the data. The investigations required as part of the study should be available in your center or nearby, and it should not cause any extra financial burden to the patient. There are many PG thesis grants available now, but one thing has to be remembered that this is given to only selected persons. So if you plan a study hoping that it would get funded by the PG thesis grant, make sure that you also have provisions to give allowances if your study doesn't get funded. You can't make your patient pay for the investigations that is only part of the study, which the patient does not require, but you require as part of the study. You can't make the patient pay for that. And you have to convince the ethics committee and the research committees should be convinced that the investigations that are required as part of the study and the study itself are beneficial to the patient. It may not be of immediate benefit if the patient benefits it in the long term, that if it gains more knowledge regarding his condition or it improves his management in the long run, you have to show that, and the ethics and research committees have to be convinced. All this comes under the feasibility of the topic. And go for interdepartmental studies only if a good rapport exists between your department and the other department. Otherwise, you would find it difficult to finish the project in time. And would be easier if the co-guide chosen from the other department is someone who has interest in the same topic. And make sure that you would be able to find enough time to collaborate with the other department in an interdepartmental study without compromising your department. Always remember that no one is going to go out of their way to make sure that you get time to do your thesis. You have to find time. So when you go for interdepartmental studies, you should be sure that you would get time to collect data from the department without compromising your department work. And the study should be interesting. It should evoke some curiosity in the mind of an unbiased person working in the specialty. For example, if it is clinical profile of vitiligo vulgaris, it may not generate any curiosity in the minds of many, because all of us see such cases in our OPD on a day-to-day basis. So better options would be autoimmune diseases associated with vitiligo vulgaris, or dermatology life quality index in patients with vitiligo vulgaris and its association with disease severity. And the study should be novel. That is, it need not be anything path-breaking, but however, would be nice to include at least one aspect that is less explored. It would help you later when you go for publication. Example, if clinical profile and demography of patients with psoriasis, it has been discussed and described and published several times. So you can just improve it by including another aspect, maybe the upcoming dermatoscopy aspect, nail fold capillaroscopy in psoriasis vulgaris and its relation with psoriasis area severity index. That would be a better option. And make sure that your study is completely ethical. Make sure that you adhere to best publishing guidelines that would take care of most of the ethical concerns. Procure all relevant consent forms. You should get written informed consent from patient for collecting clinical data, for getting images, and consent for publication. If pre-validated questionnaires are used for the study, you should get permission from the relevant authorities. Because there are copyright owners for each questionnaire. They have devised the questionnaire. They must have published it. Some of them may have made it free to use, but you have to get permission stating the same. Most of the institution research committees and ethics committees make sure that the residents get such permission from relevant authorities. But recently we received a study for our journal and they didn't have the copyright agreement saying that they can use the questionnaire. So in spite of being it a good study, no journal can publish it. Or you can even go and prepare a fresh questionnaire. But fresh questionnaire preparation, there are certain steps to be followed. You have to prepare a questionnaire, you have to get it validated by experts, then you have to get it converted to regional language by translating it from English to Malayalam, because vernacular language being Malayalam for us. Then another person should translate it back to English, and you have to compare the original English version with the latest English version to see that during this translation and back translation, there is no gap in information we want to provide and what the person understands. And the same thing has to be pilot tested in a group of study population, that is people drawn from the same group of study population, and see that if the questionnaire can be easily understood by all of them. If they are finding it difficult to understand, we have to modify the questionnaire accordingly and then get it validated again. So all these procedures are involved in a preparation of fresh questionnaire. So all these things you would learn in subsequent sessions, but all this comes under the proper ethical practices. And if you receive services from another department for study, make sure that you have a co-guide from that department. And the study, the topic chosen, it should be relevant. It should have some significance with respect to present day knowledge. That is, if you take comparison of clinical diagnosis and Sank's smear analysis in autoimmune blistering disease, this may not be relevant today because we have more advanced diagnostic techniques these days, and nobody relays diagnosis on Sank's smear alone. A study assessing sensitivity and specificity of diagnosis based on clinical and Sank's smear analysis in comparison to the same based on the gold standard of histopathology and direct or indirect immunofluorescence in autoimmune bullous diseases would be a better option. Or one can go for DIF analysis of salt split smear in pemphigoid group of disease, which would help you to differentiate bullous pemphigoid from other group of pemphigoid diseases which has got a floor binding pattern. So translating all this theory to practice, where to get these topics, there is an IADVL postgraduate thesis topic bank proposed by the special interest groups of IADVL Academy. You can get nearly 250 topics are there. You just copy paste this IADVL postgraduate thesis topic bank by IADVL Academy. You do a Google search, you will come across all those topics. But personally, I would suggest do a literature search in quality journals. Why? I would come to it shortly. Then you choose a topic of your interest, review the statistics, a few topics of your interest, review the statistics of your department to see how many of them are feasible for you. Because how many cases would be the yearly for each such case scenarios, and choose a topic where you get adequate number of cases. And go through past 5 years thesis list in Kuhas site, because Kuhas does not allow same study to be replicated within 5 years. If the similar study has been done in the past 5 years, one doesn't have to worry much about. All you have to do is modify your topic to avoid duplication. You can stick to the original concept, but modify your topic so that you can avoid duplication. So you choose topics, IADVL postgraduate topic bank, thesis topic bank is there. But a better one would be go through original articles or study letters in recent 3 years in standard journals. And most of the journals I have written here, they are Indian journals, because the studies and study letters published in international journals, they would be beyond the scope of a PG thesis. So for PG thesis, let us stick to Indian journals mainly. And IGDVL, it has become an international journal. Most of the original articles are written by foreign authors, but you can focus on study letters. The study letters in them can give you an idea of what you can do in our setting. Then leprosy review, that is a international journal, but most of the work on leprosy is done in India and other developing world. So few of the ideas from there can help you choose a topic for your thesis. Then the last one, that is dermatology, practical and conceptual. That is another international journal, but you will get good ideas on dermoscopy related topics from here. Why I suggest literature search in quality journals over IADVL topic bank is, IADVL topic bank, they will just give you the topic titles. But if you go through original articles and study letters in quality journals, you would get an idea how to develop your introduction, how to do write your methodology, and what are the parameters to be assessed, how to define your study population. You get all this information, and how to state your results, how to write a discussion relevant to the topic. All this information you will get by reading quality journals. And after literature search, choose some topics that interest you, discuss with your guide, narrow down your choices, and then go for the topics that are feasible in your setup. And how to know that? Before reviewing the statistics of your department, you have to determine the required sample size. You can do that with the help of your guide or faculty from the social and preventive medicine. There is definite ways to calculate the sample size for each study design. All these things will come later in this series. But before that, if you have to determine the sample size, discuss with your guide or the faculty from the community medicine department and determine the sample size. Then go through the past 3-year OP or IP statistics of your department. But better to choose years 2018, 19, and 22. Better avoid COVID-19 years, because the data of 2020 and 21, they are more or less skewed data. So you get many patients were not attending our OPDs during those years. And from this OP statistics, you will get information regarding the feasibility of these selected studies. Which among these studies would give you adequate number of patients in 1 year. By this, you can further narrow down the topic selected. Then go through the past 5 years thesis list in Kuhas site. Kuhas does not allow the same study to be repeated within a 5-year period. You don't have to worry. You don't have to discard your topic of interest. Only thing, you have to modify it a bit. So if you plan to do clinical profile, histopathology, and immunofluorescence findings in intraepidermal vesiculobullous disease, and if you see that it has been done within past 5 years, mind you, I am not saying it has been done within past 5 years. I haven't checked the list. It is the Kuhas site. You go, you can see the list. I haven't gone through the list. I am taking a hypothetical scenario. I am saying this study has been there in the list. Then you can just modify it. You can do a clinical profile, histopathology, and immunofluorescence findings, and life quality index in patients with dermatology, life quality index in patients with intraepidermal vesiculobullous disease. You make a modification, you want something more, and you can do the same study. Or you can go for a comparison of health-related quality of life in patients with intraepidermal vesiculobullus disease assessed using dermatology life quality index questionnaire and autoimmune bullous disease quality of life questionnaire. This DLQA questionnaire, Dermatology Life Quality Index questionnaire, most of your seniors would be familiar, as also many of the all the faculty would be familiar. But there is another questionnaire is there, that is autoimmune bullous disease quality of life questionnaire. So to form such topics, to think of such topics, we need to have information regarding all these questionnaires. So where do we get it from? Here comes the importance of literature search in recent journals. I was not aware of this second questionnaire, autoimmune bullous disease quality of life questionnaire. I came across it while reviewing one article submitted to JSSTD. Initially, a group assessed the health-related quality of life in patients with autoimmune bullous diseases using DLQA questionnaire. Later on, another group devised another questionnaire specific for autoimmune bullous disease, and they suggested that this autoimmune bullous disease quality of life questionnaire is better than the DLQA questionnaire. Then there is another group who compared both this and said DLQA is as good as autoimmune bullous disease quality of life questionnaire. So at this point of time, there exists a discordance in literature regarding these two questionnaires, efficacy of these two questionnaires in assessing health-related quality of life in autoimmune bullous disease. So you can very well take it up and see the impact of both these questionnaires in our population. That could add some novelty to the study as well. So do a literature search, you will get more ideas. It is not only to pick your topic, it would give you more ideas. Then relation between nail fold capillaroscopy findings and organ involvement in systemic sclerosis. Okay, you checked it and it is all, if you see that it is already done, you can just alter it. Relation between nail fold capillaroscopy findings and organ involvement in systemic lupus erythematosus. If that is already done, don't worry, you can modify it as relation between nail fold capillaroscopy findings and organ involvement in collagen vascular diseases. Most of the cases of systemic sclerosis and SLE would be there, and a few cases of rheumatoid arthritis, mixed connective tissue disease, and myositis also would be there. Or you can, while going through the literature for all this, you would see new articles which say nail fold capillaroscopy assessment for risk factors for development of new digital ulcers in systemic sclerosis. And the articles say that mean number of capillaries per millimeter on the middle finger of the dominant hand. A reduction in the mean number of capillaries serve as a risk factor for development of new digital ulcer in systemic sclerosis. The given article follows up the patient for 6 months. You may cut it short to 3 months or so that it fits your requirement, because you are doing a PG thesis in a time-bound manner. You need to have your data within 1 month, within 1 year. So a 6 month follow-up period would be difficult for you. Or you can even modify it as risk factor for development of digital ulcers. You can even avoid risk factors for new ulcers. You can do a cross-sectional study on risk factors for development of digital ulcers in systemic sclerosis. That is, when the patient comes to you, you just assess he is having digital ulcers and the age, gender, smoking, occupation, and nail fold capillary pattern. All this, if they have any association with digital ulcers. If nail fold capillaroscopy is difficult, it can even be a demography study on risk factors for development of ulcers, digital ulcers in systemic sclerosis. Comparative cross-sectional analysis of nail fold capillaroscopy in psoriasis patients and normal controls, if you want to do. If it is already done, you can modify it as relation between nail fold capillaroscopy pattern and clinical type of psoriasis, or relation between nail fold capillaroscopy pattern and psoriasis area severity index. If clinico-mycological study of cutaneous dermatophytosis, it has caught your attention, but it is already done, just modify it as clinico-mycological study of recalcitrant dermatophytosis. But before doing that, you should know what is defined as recalcitrant dermatophytosis. Again comes the importance of literature search, because in the past 3 years, it has been published into 2020. IADVL has an IADVL task force for recalcitrantemia. They have defined this. You have to define your population and select your study participants accordingly. After choosing a topic and narrowing down after determining the sample size, you choose one topic and then you can go for literature review. Literature search is broad scanning of original articles, and you are in this context. in this context, in literature search, we used to scan original articles and study letters to choose your topic. Now, since you have now narrowed down it to one topic, now you have to go for an extensive literature review. For example, if you are studying relation between nail fold capillary pattern and organ involvement in systemic sclerosis, you can search Google Scholar and PubMed. And when you write the methodology and all, better to focus on PubMed index journals, because PubMed index journals, they have been assessed by the PubMed agency, indexing agency, and those journals that stick to certain guidelines, they only get selected in the PubMed. So their methodology would be better than a random journal. At least maybe a random journal can have a good articles with good methodology, but we are not sure which among them are correctly following the right approaches and which are not. Whereas in PubMed index journal means it gives some authenticity to the data published in the journal. So while you write the methodology section, focus on journals in the published in PubMed. Here, instead of in literature search, while we were choosing the topic, we were focusing on original articles and study letters. Here, our aim is to get more information regarding the topic in depth. So here we are thinking about only one topic, we have to go in depth. So you have to search for review articles, systematic reviews, meta-analysis, original articles, study letters, everything that has been published. Here we are studying relation between nail fold capillary pattern in this example and organ involvement in systemic sclerosis. So you have got a specific topic and some broad topic. One is that systemic sclerosis and organ involvement. Other is the importance of nail fold capillaroscopy and dermatology. And then one is nail fold capillaroscopy and systemic sclerosis. These are all broad entities, and then you have a focused area, that is systemic sclerosis and organ involvement and nail fold capillaroscopy. For the broad areas, that is organ involvement and systemic sclerosis, you can read the latest literature. Rather, you should read the latest literature, that is in the last 2-3 years, published in mainly PubMed index journals, nail fold capillaroscopy and dermatology. Again, read the latest literature. If you get good review articles, they would give everything from the beginning till the latest advance in a nutshell. And nail fold capillaroscopy and systemic sclerosis, this also you should know what is from the beginning till the latest in a nutshell. For this, focus on systematic reviews, review articles, and meta-analysis. Read the latest literature, and you can build up your background of review of literature like this. Systemic sclerosis, you just start with what is it and what is the pathogenesis, the role of endovascular thrombosis in it, and how it affects the organs. And the next, you just talked about the importance of nail fold capillaroscopy, why it is helpful in assessing the blood circulation in the body, because all other areas, blood vessels are vertical to the skin surface, whereas in the nail fold, they run parallelly. So you are able to assess the blood flow over a longer extent. So nail fold capillaroscopy, when was it introduced in dermatology and in which all conditions it was used, to just mention, and then go for how it was found useful in systemic sclerosis and what are the previous studies that talked about nail fold capillaroscopy and systemic sclerosis. Then you come to the systemic sclerosis and organ involvement and nail fold capillaroscopy. Here you have to go through all the studies and all the review articles described in literature regarding nail fold capillaroscopy assessment of systemic sclerosis and its relation with organ involvement. Here you have to go through all the available literature right from the beginning till the very latest. You can't just manage with having the data in a nutshell by reading it from a review article. Here you have to go through the entire literature in your focused area. So why do you want to have information from the beginning? You have to collect data for the review of literature section. Many times residents come and tell us, I don't have many articles on my thesis topic proper. So how can I write the review of literature? So I want a topic on which there are many articles written. Never go like that, because if there are less number of articles, that means your study will get more chance of publication. Review of literature we can write by building the background for the study and what is known about this and what are the future prospects and what you are trying to attempt. For that, if you start from the beginning, you get all the data on your focused area and many broad spectrum, that is what is systemic sclerosis, its pathogenesis, and about the dermatoscopy. If you collect data on this, there will be enough material to write your review of literature section, and it will help you to get an in-depth knowledge of the topic. And this will also help you to identify gaps in knowledge. There are aspects that would have been studied, that were studied by previous authors, and most of the authors would conclude by saying, we saw these findings, but we can't give explanation. We need more studies. If you go through the literature from the beginning till the recent, you can see that there are many threads that were never explored further. You can pick those gaps in knowledge that can be utilized in your study, which would improve the quality of your study and the value of your study. Then why do you want to have most recent literature? Medicine is a rapidly progressing field. To gain information regarding the latest parameters to be assessed in your study, you need to have information on most recent literature. Taking the example of this nail fold capillaroscopy in systemic sclerosis, when nail fold capillaroscopy was introduced initially to evaluate patients with systemic sclerosis, investigators used to document the findings such as these many % patients had capillary drop hemorrhages, these many had giant capillaries, and these many had tortuous capillaries. But later on, a classification was proposed which classified patients based on capillaroscopic pattern into early, active, and late pattern. Early pattern, not much difference, only a few dilated capillaries. Active means many giant capillaries and capillary hemorrhage. Late pattern means capillary dropouts and dessert-shaped capillaries. So if you don't go through the recent literature, you would miss this. And you would be documenting your findings such as these many had capillary dropouts, these many had hemorrhages, these many had giant capillaries. And when you send it for publication, the journal would send it back asking how many had early, how many had active pattern, how many had late pattern, and what was its relation with duration of disease or the severity of disease. Then it would become very difficult to get your article published because you don't have data collected that way, and your thesis would end up as a work inferior to all the recently conducted studies. We have to avoid that. That is why you have to read the recent literature, the most recent literature, and then build up your study accordingly. So in a nutshell, how to choose a topic and do a literature review. You can rely on the topic bank, but I would suggest literature search in quality journals. You can take the help of this topic bank, but also do the literature search in quality journals. It would improve your scientific temperament. Reviewing the statistics of your department, you can narrow down your choice and go through past 5 years thesis list in PUHA's site and modify your topic to avoid duplication with the work published done in the last 5 years. After that, do a thorough literature review, recent articles on the broad topic, and thorough review from the beginning to the latest available matter on the area focus. This is all I have to say. Thank you very much.
Thank you, Sarita, for that wonderful session. And that was a very practical and very informative session. And she's not only taught us how to choose a topic, she's given so many new points. She's gone through so many articles, and that was very informative. It will be very useful for the postgraduates. If you have any queries, you can unmute or put in the chat box so that we can ask. I think that was very clear. If there are no questions, thank you, Sarita, so much.
Thank you, ma'am.
Yeah, thank you. Can we move on to the next session? Now I request Ajit Kumar sir a great researcher and a teacher par excellence. Sir has a special interest in HIV and Bullous disorders. He has various publications and innumerable publications and has authored many books and edited two or three chapters. And he has various presentations to his credit. He was awarded the Topic Oration in 2021, IADVL Kerala Oration Award in 2017, Special Award for the Management and Administration by Government of Kerala 2009, Best Service Provider Award for Clinician in HIV Field from Kerala State AIDS Control Society 2006, BK Nair Award for the Best Research Publication by IADVL Kerala. He is trained at Oxford Immunodermatology, Minnesota for HIV. He has special interest in HIV, clinical research, and Bullous disorders. Over to you, sir.
Is my slides visible?
Yes, sir.
Okay, thank you. Thank you, Dr. Sarita, for that lucid presentation, which made my job easy. Actually, it's almost a repetition of what I'll be presenting in a different way. I know many of these postgraduates of KUHS have already submitted their synopsis for their thesis, but still, I think discussing how to make a research question, how to frame it, how to evolve with hypothesis and objective is still important, because that will help you to understand the subsequent sessions in the next few days to come. We'll be discussing about research topic, which already Dr. Sarita has done, or idea, and research question, hypothesis, and object. You know, all the proposal format have all these terms. So I'll try to just clarify what these are actually. Many times research happens like this. People take up one area of the study and just collect all the data, and after 1 year or 2 years, you get a lot of data. 50% will be junk, 50% will be partially filled. Then they try to find out, make some sense out of this. So it's like going for a fishing expedition, and you try to collect whatever you get. But research should not be like this. Research should be like this. You have very definite, clear question. You are making a methodology to find the answer and trying to solve that problem. So it should be like this, not like this. So for that, we have research ideas. You decide which area you want to try. But idea is not enough. Like Dr. Sarita mentioned, the IADVL bank, which unfortunately or fortunately, I also was part of it, as being the coordinator of SIG, doesn't give a research question or a objective. It just gives research ideas. And if you go for a KUHS, the research thesis bank also may give good ideas, but you cannot replicate it, and you should not replicate it also. Even if it is 5 years old, it is out of no point in replicating it again and again. No point in reinventing the wheel, because somebody has already done. Anyway, you are wasting your 18 months or 24 months time. Why can't we do something new? So that's very important. So you should be very clear what you are going to do in the next 16 months. And the more clear you are, you will be, the chance of publishing will be more, and you will be using it very fruitful. Otherwise, at the end, you may find it difficult to write the discussion, do the analysis, and get your thesis published and even accepted and published. So it should be very careful when you start the study. So you selected an area of interest. Just take it as COVID-19. You cannot do a study on COVID-19, just COVID-19. Collect all the data on COVID-19 and analyze. No. It can be the profile of COVID-19, demographic profile of COVID-19. Even if it's a descriptive study, you are just collecting that demographic or a socioeconomic or geographic or masking against COVID. How and what happened over the years? Or did masking help in reducing the severity of COVID? Or did it help in reducing the number of people who got COVID? All these are still relevant. Treatment response to COVID-19. We tried almost anything possible in the last 3 years. So we can do studies on that. Molecular epidemiology, still relevant. We are reading every month new molecular variants are coming. What's the difference between vaccinated and non-vaccinated, or vaccinated twice, vaccinated thrice, and different types of. And complication, long COVID and complications of COVID. All these are research ideas, not research questions. So you have reached COVID, you have decided to do something on COVID. Then you ask the question Dr. Sarita already mentioned. Why is this research important? So just because you want to do a thesis and get an MD, or is it going to be useful for anybody? And what others people have done, that's the detailed literature search. And what they have found. And where is the gap? So you identify the gap. What is the issue? What is the problem which you are going to address? Try to be focused. That is the best strategy, I would say. So you may be just describing the topic. It doesn't mean that just to put the numbers in. When you describe, as you go for a descriptive study, probably you will be looking for what's the incidence, what's the prevalence, what's the pattern, what is the which is more, which pattern is more, which pattern is less, or something like that. Or a relational question you can form, saying, what's the relationship between these two? For example, what's the relationship between age and androgenetic alopecia? Is as the age grows, there are more people with androgenetic alopecia? You may say yes, but is it true beyond the age of 70? When more people becoming older and older, beyond 70, does the prevalence of androgenetic alopecia increases? Or is it true about between 10 and 30 years? May not be. Maybe may not be. So androgenetic alopecia, and what's the relationship? Then, okay, you found out some relationship. Is it a causal relationship? For example, androgenetic alopecia and hypertension. You may see a relationship. But is it actually the relationship, or is it the relationship due to age or some other factors, androgen levels, or whatever it is? So you can get different types of research questions even in a same research area or even inside a topic, research topic. So you should identify that, or you should decide what are you going to look at, because your hypothesis is going to be according to that, your statistics is going to be related to that, and your methodologies will be related to that. That's what again Dr. Sajida suggested. Even if you are doing a study which is already done, you can modify those studies to find out, to address the gaps in that study using probably a different methodology, different question, different statistics, methods, etc. But never, it should not be never to just copy it or make your life easier. When you do that, actually your life will become more difficult, because you will be focusing at a very, very small area for answering that study. So I would suggest, if possible, take up entirely new study which is feasible. Otherwise, only go for the KUHS website. You can use KUHS website to make sure that you are not repeating what is already done or being done. You can go to the IADVL thesis bank, just get an idea maximum. That's all, because it's around 250 numbers of study ideas are there. Many of them are not feasible, I know. Many of them are already done n times. Many of them are not focused also. So we are coming to research question. I focused. What exactly research question? Exactly is that what the investigator want to know. It should be of some importance, and it should be ideally it should be an unresolved issue. You keep on doing it, doing the same thing which is done, nobody will publish. Even the university may sometimes object to that. And as far as possible, be focused, address one issue or one or two issues, not to be too wide, and should be clear and concise what you are looking for, and feasible to undertake. That's very, very important. Like Sarita mentioned, it should be feasible. But as for the thesis, better not to be too ambitious, because you just have 1.5 years time, and most of the time you will be spending with other engagements like studying, preparing for the exam, improving your clinical skills and your patients, OP, IP, etc., etc. So it should be something very feasible, financially feasible, practically feasible, etc. And it should be a question which should be answered directly by analysis of data. So it should have I'll come to that. And any research question should be answered, or should be something which can be answered by a mathematical equation, as a statistical answer. And definitely adequately resourced, which already Dr. Sarita mentioned. To make it simple, okay, this is your topic is role of vitamin X on hair density. We keep prescribing various vitamins to men and women who are coming with hair loss and thinning of the hair. So you want to study that. That's your area, because you think a lot of patients coming, so feasibility will be easier. Okay. So what is the question we are going to ask? Is there a relationship between the amount of vitamin X in the diet or in the supplement which you give, and the hair density? Or can be, does adding vitamin X 500 milligram daily is going to increase the hair density? Or can be the vitamin X in the diet going to change the hair density, or something like that? So, but you should be clear, what are you looking at? Are you looking at the food? Are you looking at the supplement you are giving? Or are you looking at the blood level of that vitamin, or the skin level of that vitamin? And are you going to count the hair in the scalp? Are you going to look at the trichoscopy or the density of the hair? Whatever you are going to, or the number of hair fallen per day. So it should be clear what are you going to look at. Then you are going to, so you have a clear, some idea about what are you going to. Then frame a research question. It should be final, like Dr. Sarita mentioned. It should be feasible. Should be able to do it within 18 months time maximum, preferably 12 months time, because you have it buffer time of 6 months. Should not be costing you too much. Even if you are a millionaire, you may not be spending that much money for your thesis. And the ethics committee will not allow you to make your patient pay. And it's very unlikely that you will get a research fund after joining, and after 6 months you apply. By the time they make a decision, you will be another 6 months. So 1 year is gone. So it may not be very feasible to get a research thesis fund in the current scenario. So it should be feasible, should be interesting, at least to you and your guide. Should be something novel. It's not something like Elon Musk do, but at least something novel to your department or in the region or in the department or somewhere. It should be something novelty should be there. Otherwise, it goes to university, or the reviewers will say that there's nothing new in it. Should be definitely ethical. You are doing a study on your patients, but they are not your patients when you do study. They are study subjects or participants. So without their consent, you cannot do anything. And you should get your ethics committee clearance, and they should agree to that, and you should be reporting to them also. So it should be definitely ethical, and it should have some relevance either for the present or the future. So relevant. So your study should be, the research question should be finer. Then it also should fulfill this criteria, PICOT. So when you write the research question, you should mention the population of interest, in which group of patients you are trying to do the study. Is it all the patients who are coming to your OPD with a history of hair loss, or all the postgraduates in the hospital, in the college, and you are going to see whether they have hair loss? Are you taking only males? Are you taking only females? Are you taking children? Are you taking patients who had only COVID and having telogen effluvium? Or only are you excluding patients who have telogen effluvium? Are you taking only patients with androgenetic alopecia? So should define your population of interest, in which type of patients you are going to take. And you are going to do an intervention. If you are going to do an intervention, what's the intervention of your interest? Are you going to give folic acid 10 milligram BD or OD? Or are you going to give pantothenic acid? Are you going to give a concoction of all these, whatever? And how many days you are going to give, how many times you are going to give? Are you going to give this injection, tablet, capsule, whatever it is? And are you going to compare it with somebody else? Are you going, or only you are going to study all the androgenetic alopecia coming to your OPD? Or are you going to compare all the androgenetic alopecia with the telogen effluvium? Are you going to compare all the androgenetic alopecia with the so-called normal men or women coming to your OPD? Or are you going to go and do the study in the community? So you should define the comparator to which you are going to compare. And what is your outcome of interest? Are you going to, if it's going to a trial or something like that, are you going to see how many new hairs grew? Or what's the thickness of the hair? Or did their hair fall decreased over time after giving you an intervention, B complex, or whatever it is? And over how much time you are going to do the study? Is it going to be 6 months, 8 months, 1 year, 2 years? Remember, when you are doing a study like that, if you are going to follow up a patient for 6 months and you will be selecting a patient for 1 year, that means your study will be for 18 months. Because the last patient will come at 1 year and you will be following them up for 6 more months, 18 months. So all this should be taken care of. So we should not end up in a feasibility issue in collecting like that. Generally, retrospective studies are not very welcome in our clinical departments. So better to avoid retrospective study. There are a lot of issues with retrospective study because you may not get enough, you may get enough numbers, but you may not get enough data because many of this data will not be available. So this research question. Does use of hydroxychloroquine 200 milligram BD reduce the mortality rate significantly at 3 weeks of COVID-19 infection? Sorry for the correction, the spelling mistake. In comparison with the placebo in patients infected with the COVID-19. Okay. Is it feasible? Yes, it can be feasible. We get a lot of patients. Still we get patients. So number won't be an issue. HCQS is available in the hospital, or it's not very expensive, and you are giving it as a medicine. So may be feasible also. Ethical committee, I doubt whether ethical committee will agree this for this study now, maybe 2 years back. Yes. And anyway, you are following them up. It's only a short follow-up. So it will be feasible to compare it between them with those who had medicine and those who didn't have medicine. Another way of doing it is, you can see whether the mortality is less in patients who are getting hydroxychloroquine for arthritis, or some kind of study. Then it will be more ethical. So that's how you finalize your research idea and research question to make it more ethical there. So here the population will be patients with COVID-19 infection who are coming to your hospital getting admitted. Again, you will have to decide whether it's OP patients, IP patients, ICU patients, etc. Intervention will be tab hydroxychloroquine 200 milligram BD orally. Comparator will be placebo. You may not be giving any active treatment for other COVID patients. And outcome will be reduction in mortality. So you should define how much reduction is significant for you. And time will be 3 weeks time. So this is an example of a research question. Then you have a research question in the format or in the evaluation formats of KUH. There's something called hypothesis. What is hypothesis? You may have to write a hypothesis in your protocol. Hypothesis is a mathematically testable statement. Here you have a question. Question can be answered, but it cannot be mathematically tested. So how to make it, convert it into a statement which can be tested mathematically. So, for example, there's no relationship between dietary vitamin X and the hair density. Or so it's a mathematically, statistically prove or disprove. You can disprove or prove this statement. So there you need help of statistician. So you will have to take it to statistician and ask how much sample size you need to prove it or disprove. Depending on your methodology, they will do a statistics calculation, mathematics calculation, and see, okay, if this your research question is this, you may need this. If your research question is that, you may need a different statistics. So we'll have a session on sample size calculation later. So here, definitely, so again, I'll tell you, always have a friend who knows statistics, or have a co-investigator from the statistics department who knows statistics. Beforehand, before you finalize your protocol, don't think that you will get all the statistics data and then go to a statistician. No statistician will be happy, or they will be able to help you at that point of time if you don't have proper data to answer your question. So there can be another question. Should we have a hypothesis always? Ideally, probably not if you are doing an exploratory study. But if you are going to do something like which you said, definitely you should have a hypothesis. So can be, you already studied it in stats and community medicine during MBBS. There are different types of hypothesis. A null hypothesis, which says there's no relationship between two things, and you will disprove it. So disproving a statistics statement is one way of proving something. Like, okay, you are saying all crows are black. As long as you don't see a white crows, this is a gospel truth. But the moment you see one white crow, your hypothesis is proved wrong. Or you can have an alternative hypothesis. Relationship exists between HCQS and decrease in mortality. So here they are not saying there's no relationship, there's a relationship. There again, the way you analyze the study, the statistics, you calculate the sample size, all can be different here. Then there can be a directional question also. Increase in the dose of HCQS is inversely proportional to the mortality. So there, the analysis will be different. So decide your hypothesis. What are you going to decide to do? A research question is essentially a hypothesis asked in the form of a question. So you can convert your research question to a hypothesis. Actually, it's in a very simple way, but make sure that you have a support from the statistician for that. For example, there's a relationship between CQS intake and COVID-19 mortality, or the infection of COVID-19, whatever the hypothesis, be it CQS reduces corona infection or the mortality, or CQS does not reduce infection or mortality. Okay. There's another term which you may come across in your protocol is something called objective. What's the objective? What's the primary objective of these two young couple? They are doing some window shopping. You are very sure that it is not to purchase this expensive footwear. They just want to probably enjoy time together. That's the primary objective probably. The secondary objective will be to do a window shopping. Probably the third objective will be to purchase it. So should have a primary, you should be very clear about your primary objective in your study. You can have secondary objectives, 1 or 2. And depending on the primary objective, you will calculate the sample size and finalize the methodology. Secondary objective and maybe multiple secondary objectives will be a byproduct of your study. So you won't be concentrating on that. You will be concentrating on the primary objective. So whatever you wrote as your research question and hypothesis will be converted as the primary objective. You may find out a lot of other things during your study when you will be getting a lot of data. From that, you may reach some ideas, new ideas, but they are only the side effects of your study because you didn't calculate the study, the sample size to find out answers for that. You didn't tailor-make your methodology to get answers for that. So the answers you get from of the secondary objective will not be the ideal. So such question is the topic which you are pursuing. Research objective is the work breakdown of your study question, research question. So research objective will have an action verb, content, condition, and criteria. I'll explain that. When you write a research objective, many of our protocols, they would have objected that the objective is not correct. For example, it will be an action verb. Usually, many people write to study is the action. The objective is to study. No, the objective, even though it is to pass the exam, you won't write it. Your objective will be to demonstrate the efficiency of HCQS over placebo. The action verb is to demonstrate. The contents will be the efficiency of HCQS over placebo. Condition, after giving drugs for 3 weeks. And the criteria is you may fix some statistical significance if it is p value 0.5 or something like that. Here, there's another study to compare. They compare the serum lipid profile of cricket players with the sedentary shopkeepers who are apparently healthy and have no complaints. Action verb is to compare. Contents, serum lipid profile of cricket players and sedentary shopkeepers. Condition, apparently healthy and have no complaints. Criteria, you may have to fix some statistical criteria or some other criteria. So that's how you frame a research objective. So objectives should be SMART. So we learned FIDER, we learned PICOT, and third is SMART. Objective should be SMART. What is SMART? Specific. Should be answering only one question. Specific. To compare, to demonstrate, to evaluate, or whatever. Specific. Should be specific. Should be very precise and should be measurable. Okay. Measurable means what's the number? What's the difference? It can be in percentage, can be numbers, or sometimes you will be assessing something like quality of life. So we have to convert that into a measurable terms. So quality of life will have some scores, or happiness, you may have some scores, and it should be achievable. Don't attempt too much. Again, repeating that, it should be realistic, feasible, and time constraint. You should make specify the time. So it should be smart. An objective should be a smart objective. When you are doing a descriptive study, usually we say estimate the prevalence of physical activity, estimate the prevalence of COVID-19 in those who had whatever. And analytical, usually we say determine whether the exercise reduces blood sugar or something. And the primary objective will be discussing what, who, where, and how. We already discussed that. Remember, again, when you decide, this is another problem which many of them face after doing all these things. How will I define your group is very, very important, because you will decide to do or study in all pediatric psoriasis patients coming into your clinic. Good. And you'll try an intervention study. When, like Dr. Sarita said, we'll collect all the data and compare in 2018-19. So you have 200 patients. You will try to do some intervention, and your patients are not happy with you. They didn't come back. So your studies flop. Probably you have 200 patients who came to you, but none of them came back. Or you are too ambitious with a large pro forma which take 2 years, and you are going to apply it in a 5-year-old child. Definitely the child, mother and father will be angry with you. They will not answer it properly. So whatever you do, make sure that it is feasible in every aspect, and make sure that it is specific enough that I already discussed, and should be very clear about the intervention. How are we going to do? Is it possible to do that intervention in your study? As far as possible, don't take up clinical trials for your study. Even if you're doing some intervention, make it an observational study. Your department is doing something, you collect the data. And many times you will forget about the comparison. Then when you start analyzing, it may not make any sense without a comparison. So again, you are in a soup. Your study will not hold good, because you are doing a study on something very common. Lichen planus, study of lichen planus, you found out some association. You found out the lichen planus is more common in the age of 20 to 40. Wonderful. Nobody has reported it. But when you analyze, you will see that your sample also has more number of patients from the same group. So it is not the lichen planus which is not common. Your OPD is having more number of patients in 20 to 40. So if you had a comparison to that, to psoriasis, age, comparison of age between lichen planus and psoriasis, probably you could have found out, okay, there's no difference. So it's important to plan your study, fix your objective, fix your research question and hypothesis, and what kind of comparison you are doing. So that's all. Thank you. For any question, I can try to answer. Thank you, IDVL research group, for inviting me for this. Again, one more year. Thank you.
Thank you, Ajit sir. That was a very wonderful session. Very practical also. Very useful for the first year PGs. Thank you so much. If there are any questions, you can please ask or put in the chat box.
Everybody is confused.
Probably they've understood everything, sir.
Hope so.
Yes, sir.
Okay.
It was such a wonderful session, both of you. And we are very lucky to have such experts in this field. And if there are no questions, we can wind up. This is a series. Students, please attend all the sessions. And it would be a very useful session. This next we have on next Wednesday, that is on 8th of this month. 8th
Thank
of this month. Then we have it on the 14th. So we have the whole schedule. Please attend. We'll send reminders also. Okay, that was a very wonderful session. Thank you, Ajit sir. Thank you, Dr. Sarita. Thank you, Faisal sir and Dr. Anuradha, secretary, for giving us this opportunity. We'll try to do better in the next sessions. Thank you so much.
Thank you all.